Okay, hey, welcome back to my blog. Today, we're going to talk about just one of the most basic things of oral hygiene care and health. It's toothbrushing. It's something we all should be doing twice a day. Not everyone does, but it's something that we really need to kind of work on. And today I thought we'd just kind of talk about some of the proper technique in brushing. Somewhere along the way your hygienist may have showed you how to do that, or whatever. I think most people probably brush too fast. They catch the front teeth and then that's about it, and kind of move on. So something to try to pick up, try to do on a real regular basis. So what we're going to do is just use this kind of oversized mouth manual toothbrush. What you kind of want to do is just divide the mouth into quadrants. Spend about 30 seconds maybe on each quadrant, so about 2 minutes it should take you to brush your teeth. So what you want to do is take your brush, angle it about a 45-degree angle, kind of get it up along the gum line, do a circular motion, move it about like that, and then sweep down as you brush as well. Don't just rake it. A lot of people will rake it really hard across their teeth and then they'll cut little grooves right into the side of their teeth and gum. So try to do that. Catch the inside, same deal, 45-degree angle down towards the gum. Get the chewing surfaces. In the front's a little different. Typically works better if you hold the brush up like this, kind of upright, catch the back of your front teeth. Same on the top. So, but do the quadrant approach, about 30 seconds each quadrant really helps. Manual brushes are great. Buy soft when you go to the store. You'll see medium and hard brushes. They're just too abrasive. Soft will get the job done. You don't need that real abrasive hard brush. We do see a lot of people buying those and doing damage to their teeth with those as well. Another thing you ought to consider is electric toothbrushes. They've really come a long way. This is kind of the Cadillac. It's Oral-B. Sonicare makes a great brush as well. But the nice thing about it, it does a lot of the work for you. There's different settings. I'll turn it on here. That's high. It's got like a medium, a low, and a vibrate. I'll just kind of demonstrate on a model. What this does, it really helps to get in between your teeth. This model is kind of supposed to demonstrate that. Just up at the top here, you can see how those bristles really work their way inside, in between the teeth. And like I said, you kind of let it do the work for you. Hold it lightly in your hand, and just kind of make your way around, spend a little time. And then it has that little vibration, little stutter step that tells you, hey, move to the next quadrant. So chewing surfaces, down along the gum, straight up to get the back of your lower front teeth. And these really do work well. Patients that we have that have had trouble with their hygiene and that have converted to an electric toothbrush, when we see them back in 6 months, their hygiene is vastly improved. And they're probably spending right about the same amount of time, but it's just that much more effective. And then this brush also has kind of a cool feature. I don't know if you can pick that up, but when you push too hard, there's a little remote deal, and it lights up right here. And that just tells you you're pushing too hard. So you kind of learn by watching that to back off. So that also is a nice feature. It's got a built-in timer to tell you how long you've been brushing. It's got a little deal that'll say when you've done your full 2 minutes, and I'll kind of let it run. When you do your full 2 minutes, it even gives you a little smiley face when you're done. So it may be the only little smiley face you get for the day. So it's a good way to start your day. Kids' manual brushes come in all kinds of different shapes and sizes. I'm going to let that run for a minute. Just to kind of generate a little interest for them. They kind of like the colored ones. When they come to our office here at Evergreen Dental, they get to choose what they want to use. Flossing's a whole different topic, but it's something that we really need to do every day. Most people don't do that either, but typically take about a 1.5 foot of floss, wrap it around your middle fingers, and then just gently take it through the contact between your teeth, kind of clean the sides of each teeth. There's a lot of floss aids out there, especially for kids, little handles with the floss in them, if I can get it open, and that's good for kids or people with limited dexterity. They can use that. See the smiley face? Got to get that in there. So anyway, flossing. You want to use it, gently go through the contact, clean the side of the tooth, clean the other side, and come out. It's just that quick. And so that really helps to get the buildup of tartar out from between and underneath the gum. Most people do. So that's it. Those are kind of the basics of oral hygiene instruction. We have 3 hygienists here at Evergreen Dental. They're all excellent. They can all explain things probably better than I just did for you. So when you come in to see us, we'll kind of help you, basically improve your own hygiene at home and allow you to keep your teeth for the rest of your life. Okay, I wanted to cover one more thing. One of the things that we're doing as part of our kind of an introduction to our blog and just kind of our educational videos that we're doing for our patients. We have a special offer that we're offering this Oral-B toothbrush as an incentive for people to refer others to our practice. So if you refer somebody, make sure they give us your name, and as they come in, once they come in and complete a full exam, cleaning, x-rays, kind of get signed up as a new patient, we will give them a Oral-B 5000 series toothbrush, and then we'll also send one to you as kind of a reward for you in thinking about us as you're referring your family and friends to us. It's a really good brush. It's got a lot of neat features. We've had our patients using it now for the last couple of years, and we've seen a lot of really improvement with their hygiene once they do use the brush. So I'd appreciate it if you would tell your friends and family about us.